The Amosmile app helps you with your self-directed learning wherever you are. Let's start the app. You can check out your current modules and the work streams you're working on at the moment. Let's start with Zplasty. You get the choice of going through a whole self-assessment program or just using the app for reference. We're going to start with the self-assessment workstream. You start with the pre-module quiz. Here we have true or false questions. This will gauge your baseline level. Next, you're guided through the chapters in a logical manner, starting with the introduction. Here the chapter is laid out along with the objectives and the syllabus you're expected to complete. You're then taken through each chapter one by one so that you can really build up your knowledge on this particular procedure. The chapters include highly interactive 3D graphics to really enhance the learning. Having completed the chapters, you then continue with a post-module assessment. This comprises multiple MCQ banks which you have to pass to get onto the next level. The minimum threshold pass rate is 80%, and you have to get that before you can move on. The app then compares how well you performed before and after the learning module, and whether you're ready to move on to the next level. You're now ready to train with the physical simulator. Here, the app gives you some video instructions on how to set it up. At each stage, you're asked to try it on the real physical simulator. You can even add your own notes on the app as you go along. The testing is not over yet. As you perform the procedure on the physical simulator, you're asked to revert back to the app and answer some simple questions to reflect on how well you've done at each stage. That way, you're self-assessing as you go along, step by step. If you get everything right, and only if you get everything right, you can move on to the end of the module. You're asked to do a quick survey on how difficult you felt the training was, and then enter your name, and you'll be given a certificate of completion, which you can save on your phone and print out later. Now let's go through some of the different chapters. Let's start with the design chapter and look at the discovery section. Here, we can actually design our own incisions. We first mark out our incisions, make our incisions, transpose the flaps, and see how this alters the length of the scar. We can practice various different iterations to see how we can make our scar longer. In the anatomy section, we have lines of tension and skin microvascular anatomy. In the clinical factors section, we can look at indications and complications to look out for in Zplasty. And of course there's a simulation section where we can walk through instructions on how to use the physical simulator and run through step by step the cognitive simulation of Zplasty on a clinical case. This stepwise virtual simulator gives you an in-depth cognitive step-by-step simulation of Zplasty in a clinical scenario. You have to select the correct instrument for each step, follow the correct incision lines, and review the patient in 3D. You can learn details, pearls of wisdom, and pitfalls for each step. Together, these modalities provide an overall cognitive, task-driven, and tactile experience, preparing you for the real thing. So you see, Amosmile provides you with the tools necessary to make self-directed, remote learning that much more effective. Amosmile.